Okay, so this is a great question, but there are a couple other questions that I want to address about taking care of a brain dead patient that I talked about in my last video. I saw one person ask if the brain stem can swell on its own, and I guess I wasn't really clear about how this all happens. So brain stem damage happens when some other sort of traumatic brain injury happens that causes herniation. Herniation, swelling of the brain. So your brain is swelling, causing all of this pressure, and all of that pressure is pushing down on the brainstem, causing it to either push down up against the spine or up against the back of the skull. And that's what causes brain death, at least in the scenario that I'm speaking about. I saw someone in the comments say that they had a stroke in their brainstem. I'm not going to speak on that because I have no idea what that's all about. Another thing that was frequently mentioned was flows. And what flow testing is, essentially, think of like a mini CT or a mini MRI or a mini scanning, if you will, of the brain. And what we will do is we will inject some sort of radioactive medication or dye, like think contrast dye, and when we inject, we'll scan the brain to see if the dye passes through the blood-brain barrier. And this is very easily visible, like through the scan. It's almost live. I don't know if it's live, like you see it live, or it's like a few seconds delayed or minutes delayed, but you see it immediately. You will see whether or not the brain is getting blood perfusion. My very first day in the neuro ICU, very first day on orientation, I went to brain death testing flows with a patient, and they were a kid, and I was like, wow, okay, this is the neuro ICU. And to answer this question, yes, the person has to, or the patient has to pass or fail, every single brain death test in order to be pronounced brain dead. I also saw someone ask, like, what two attendings would be the ones, performing the testing and calling the time of death. In my area of work right now, in the trauma ICU, it would usually be the trauma attending and the neurosurgery attending.